Hi international track students, I'm Ibu Teresia. Now I'm bringing Caring in Nursing Care topic in your Introduction to Nursing Professions course. And the learning objectives are the first one, theoretical foundations and client perception on caring. The second one, ethics in nursing practice and nursing care. And the last one, caring in Christian perspective and the difference between caring and curing. Caring in nursing care is the most important and the central to nursing practice, where productivity and efficiency can interfere with nurses' capacity to be caring and compassionate professionals. Moreover, in the nowadays, when the healthcare systems need more high technology and fast culture in the healthcare situations. Let's continue with the first one, theoretical foundations of caring. Actually, there are more and many theories in nursing practice who concern in the caring theories. Based on Elligood 2018, there are at least these three theory regarding caring. The first one, Watson's transpersonal caring. Watson's transpersonal caring focus on the 10 caritas process and the 10 character factors. And the second one is Swanson's theory of caring. And the Swanson's theory caring focus on the 5 caring process and the theory focus on developing useful and effective caring strategies. And the third one is the Leninger transcultural caring. And this theory focus on to be effective caring need to be culturally specific. So the culture perspective is the focus in this transcultural caring theory. Let's take a look of the Watson's caring theories. The 10 curative factors and the 10 caritas process. The first curative factors is the formation of humanistic and altruistic system of values. And the caritas process of it is practice of loving kindness and equanimity within the context of caring consciousness. So the keyword is caring consciousness and the loving kindness. The second curative factor is the installation of faith and hope. The caritas process of it is being authentically present and enabling and sustaining the deep belief system and subjective life world of self and one being cared for. So the keyword is like authentically present. So whenever you are a nurse and maybe you are a nursing students, when you do your clinical practice, whenever you present next to your patients, it means that you try to do the caritas process, the second caritas process. The third one of the curative factor is the cultivations of sensitivity to oneself and to others. And the caritas process of it is cultivations of one's spiritual practices and transpersonal self going beyond the ego self. So the keyword of this process is cultivation of the spiritual practice and transpersonal self. The fourth one is the development of a helping trust relationship. And the caritas process of it is developing and sustaining a help trusting authentic caring relationship. So the keyword is trusting authentic caring relationship. So whenever you can be a trust nurse for your patients, that time you are trying to do the caritas process number 4. And then the fifth one is the promotions and acceptance of the expression of positive and negative feelings. And the caritas process of it is being present to and supportive of the expression of positive and negative feelings as a connection with a deeper spirit and self and the one being cared for. So the keyword is being present to and supportive of through the negative or positive feeling of your patients. The sixth one is the systematic use of the scientific problem solving method for decision making. So the keyword for the Caritas process is creative use of self and always of knowing as part of the caring process to engage in the artistry of caring healing practice. So the keyword is the art or creativity in this Caritas process. The second one is the promotion of transpersonal teaching learning. So in nursing, you also have to learn about the teaching and learning. The Caritas process of it is engaging in genuine teaching learning experience that attends to unity of being and meaning, attempting to stay within others' frame of reference. So the keyword for this seventh factor is teaching and learning situation in the nurse to patient relationship regarding caring. Curative factor number eight is the provision of supportive, protective, and corrective mental, physical, societal, and spiritual environment. And the caritas process of it is creating healing environment at all levels, physical as well as non-physical, such as the psychological, the societal, and the subtle environment of energy and consciousness, whereby wholeness, beauty, comfort, dignity, and peace are potentiated. So the keyword of this number eight Caritas process is create the healing environment for our patients. The ninth one, the assistance with gratifications of human needs. So the Caritas process of it is assisting with basic needs with an intentional caring consciousness administering human care essential which potentiateness and alignment of mind body spirit wholeness and unity of being in all aspect of care. So the keyword of this is basic needs. So whenever you provide the basic care needs for your patients, it is already reflect the Caritas process number 8 based on the Watson's caring theories. Don't forget these students. And the number 10 of curative factor, the allowance of existential phenomenological force. The caritas process of this opening and attending a spiritual existential dimension of one's own life death, soul care for self, and the one being cared for. So maybe this Caritas process number 10 may be a little bit difficult, but the keyword of it is try to fulfill the spiritual needs of our patients. So that's all the 10 curative factors and the 10 Caritas process based on Watson's caring, transpersonal caring theories according to Ellie Good 2018. Now let's move on to patients' perception of caring. According to Potter and Perry 2021, if the patient being asked, since I have been patients here, the nurses are the first one, have a mutual problem solving. So do you have a mutual problem solving for your patients? If you do that, it means that you are perceived to be caring by your patients. And the other thing that patients perceive that you try to do caring to them is are attentive reassurance, human respect, affiliations needs, healing environment, encourage with manner, provide basic human needs, and whenever you do that, so the person you care will perceive that you do caring to them. Okay, now let's move on to ethics of caring. Ethics of caring. Actually, nurses do not make professional decision just only based on intellectual or knowledge or analytical principles. On top of that, ethics of care must be placed caring as the center of decisions making process. This is based on Ellie Good 2018. And how about the caring in nursing care? Now we will take a look more on caring behavior in nursing care based on Potter and Perry in 2021. The caring behavior can be reflected from this behavior, such as the first one. I will read from the bottom of this picture. The first one, presence. So whenever you be present in the your patient's bedside or next to your patients and the family, it means that you do the caring behavior. The second one is touch. Touch in this term uh, must be done ethically and have a purpose to show support, to show willingness to be empathic to your patients. So the touch also as one of the caring behavior in the nursing practice. The third one is listening. So whenever you listen to your patients, listen to their needs, listen to their compliance, listen to their perspective, it means that you also do the behavior of the caring. And next, knowing the patients. Whenever you really pay attention to many aspects of your patients, you also do caring practice to them. And spiritual caring. Previously, we already know about the Watson's curative and caritas factors. You already know that spiritual needs, spiritual caring is also the important part of showing caring to your patients. And the next is relieving symptoms and suffering. Um, Actually, as a nurse, we try our best to decrease the problems, the nursing problems in our patients. Their suffering, we have to deal with, and we have to try using the nursing implementation, nursing intervention to also decreasing their suffering. And the last one is family care. Don't forget your clients is not only your patients, their family is also as our part of caring behavior must be reflect too. So whenever you see is there any problem in the family patient's family, you have to consider it and you have to pay attention of it. So whenever you pay attention of it, it means that you also do caring for the patients. And the next we will learn about the caring based on Christianity. Actually, there is limited terminology in Bible that really exact has caring on the in the written text, but there is another word which is compassion that really has close meaning to caring. So let's take a look of it. Actually, for the compassion, there are many many descriptions in our Bible who which reflect the compassions. But I choose this part from Matthew 15:93 to 39, when Jesus feeds the 4,000 people. Jesus called his disciples to him and said, I have compassion for these people. They have already been with me 3 days and have nothing to eat. I do not want to send them away hungry, or they may collapse on the way. So, if we take a look at this story, uh, it said that Jesus have compassion. So Jesus fulfilled the basic needs of the thousand peoples surrounding him that day. And the basic needs, what is the basic needs in this story? Food, yeah. And then we can really have the same or close meaning between compassion and caring through this story. So whenever we do our duty, our part in the nursing practice, always remind in our mind that, yeah, compassion and caring has a close meaning. So let's we follow what Jesus already told us, and his example is the perfect one, right? And the last part is the difference between caring and curing. Actually, based on Watson transpersonal caring in Potter and Perry 2021, transpersonal caring theory rejects the disease orientations to healthcare and places care before cure. So, the first thing that we can do as the healthcare professionals is care, even before the cure happens. Yeah. So that's the difference, because being present, being attentive in listening to the patient, it's already part of giving caring to the patients, even before the medicine will be prescribed for the patient. So this really the basic difference of these two concepts, caring and curing. So it's also be reflections to us, we as a nurse, we as the professional healthcare professionals, our most important job is giving caring to our patients. Yeah, maybe we can have the delegative or the collaborative implementations, but don't forget actually our own professions goals is giving care to our patients. So this is the reference that I used, Elligood 2018, Potter and Perry 2021, and Perkins 2021. So regarding the caring role play video assignment, I will give you more explanations in Learn. I will upload it. So please do the role play and then you record it in the video, and then you can upload the video maybe to your personal, one of the member of the group personal YouTube, and then you copy the link of the YouTube and upload it in the Microsoft Word. So you can use any theory of carings. You can use maybe Watson caring theory, Swanson caring theory, Leininger caring theory, or maybe you can use the curative factors, Caritas process. You can use all of it. You have to write the explanations, what kind of theory and what is the detailed, caring explanation that you record in the video. Okay, students, that's the assignment explanations. Thank you for your attention. Never hesitate to call me, maybe through WhatsApps, through the PIC, or you can find me in my email, teresia.fon@uph.edu. Thank you and see you in the next topic.